Thanks. It's really a pleasure to be here. And like Catherine, I see a lot of friends in the audience. So although we know we're preaching to the choir, hopefully this will be something new to some of you. I want to talk about a local program here in our community that has existed for quite a long time in various iterations. Behind all the numbers, this is a community that has had the political will and has found the way to address this issue. Program actually has a long history. Some of my colleagues in the audience will know this history well. I won't go through the history except to bring home the point that we here in Ann Arbor in Washtenaw County have been addressing this issue for the better part of 20 years. The other thing that I will say about this is that we here in Washtenaw County are not unique in terms of local communities addressing these issues. There are counties across the state of Michigan that have programs like this. There are communities across the nation that have local programs intended to address the needs of the folks in their community. What is the Washtenaw Health Plan? I put our mission statement up here. We're simply in the business to expand access to health care, improve the health status of low-income, uninsured residents here in Washtenaw County. We do that by developing programs in partnership with local health care organizations. There are a lot of people who have worked, and a lot of organizations that have worked for many years. And what we do together is to promote, organize, arrange, and finance access to health care. We run a number of programs. We manage a program for the state of Michigan, the Adult Benefits Waiver Program. Like I said, there are others in the state who are doing the same. There are 27 county health plans managing the ABW program in 72 of Michigan's 83 counties. This is a state program for childless adults who are the poorest of the poor. They are people with whose incomes, thank you. There are people whose incomes are below 35% of the federal poverty level. That's less than $300 a month. These are many of these folks are homeless or near homeless. As a result of their lives in poverty and their inability to afford health care, by the time they get to our program, they are patients with very complex health care needs. And as a result, they're high users of multiple services. Currently, we have 1,185 people enrolled in the Washtenaw Health Plan. Statewide, there's something like 60,000 people enrolled in the Adult Benefits Waiver Program. We run our WHP Plan B program, which is a program for low-income, uninsured county residents. Incomes at or below 200% of the federal poverty level. As the provider of last resort, we don't enroll people who are eligible for Medicaid or Medicare or other public programs. We don't enroll folks who have access to private insurance. Currently, we have 8,200 people enrolled in this program. Jumping back to my history slide, when this program started in 1989 as just a hospital program, we were providing service to 125 people annually. We are now, through Plan A and Plan B, covering over 9,000 people. I will just say a couple of things about the folks who are enrolled in these programs. Many of them, too, are very ill. They've had to forgo health care because they couldn't afford it. But as Catherine was talking about, many of these folks work. Incomes above $40,000 a year for a family of four, but they work in businesses that don't offer health insurance. In addition, there are many immigrants in this program, immigrants who are not eligible for other public programs, and that certainly presents the challenge to our providers of delivering culturally competent care to a set of individuals who come from places where health care delivery here in the U.S. finally, I'll say, as a sign of the economic times, growth in demand for our program is spiraling out of control. In the last year, program enrollment grew by 40%. So, as another sign of the declining economy, we're seeing many more middle-class people come and try to enroll in the program. People who've had jobs, they've had insurance, and now they find themselves without. So what do folks get when they enroll in the program? They get a variety of healthcare services. The model is that they're assigned to a primary care home that where they can get their routine healthcare services, but they also have access to a wide array of other services, including specialty care, radiology, lab, hospitalization, and that's through the incredible generosity and of our hospital partners. They have access to prescription drugs. I'll say quickly, if there are physicians here in the room who prescribe off the WHP formulary, I apologize for the frustration that you undoubtedly feel about prescribing off a formulary that includes the cutting-edge drugs of 20 years ago. That, unfortunately, is a cost savings measure, but folks do have access to prescription drugs to help them get the needed medicines. Ambulance is covered for our Plan A members, and we also have a very small, limited mental health benefit. Many of the people in the program have mental health issues but fall short of the criteria that one needs to meet to gain access to the community mental health system. So we have added a limited mental health benefit. Couple of other programs that we run a small business health plan, which is a third share program where the premium is divided equally between an employee, the employer, and a public subsidy. It is really and truly a very low-cost, very modest health benefit, but it does include primary care, hospital, mental health, and substance abuse. As Catherine's slide showed, small businesses are getting out of the business of providing health care to their employees, which underscores how difficult it's been for us to attract small businesses on the margin into this program. And after a couple of years, we've got 6 businesses and 24 covered lives. Finally, we run a prescription drug discount program. We started this prior to the Medicare Part D program. It's just a discount card targeted at community members with limited prescription drug coverage. It's not a benefit, it's not the panacea, but people without a prescription benefit can get up to 30% off the cost of the retail drugs, and when you're poor and paying $100 or $200 a month for your drugs, even saving $30 is a help. We've got 2,500 people enrolled in that program. How is this funded, you ask? Catherine said, "Show me the money, honey." This particular program is funded in a very complex way, but the short version is that it's a combination of local, state, and federal funds. Our ABW program is funded with state money. But the real linchpin in the funding for this program is the donations from our hospital partners, the U of M and St. Joe's, who together underwrite millions of dollars in uncompensated care. Also, we have a little teeny tiny Pfizer grant that, of course, is going away that provides durable medical equipment for our members. So how have we been able to do this? Well, I will say that this has been a community collaborative with the political political will to make something happen. There have been so many people and organizations that have been involved in this. And it has truly been a partnership for community benefit. Our partnership includes a variety of folks. It includes the two major hospitals in the community, U of M and St. Joe's. It includes the county government. It includes safety net providers like the Packard Community Clinic, like the U of M School of Nursing, nurse managed centers that have existed long before us to provide care to the uninsured. And this is a community with the passion, the political will, and the creativity to provide a program that includes a wide array of services and lots of creative planning. We're proud of our accomplishments. With our 4 programs, we're serving 12,000 people in this community who are un- or underinsured. But that, I will tell you, is just half of the folks who we believe would be eligible for our programs. We estimate that there are probably 25,000 low-income uninsured in our community. So it's great to say we're serving 12,000, but we're not going to stop until we serve them all. With that, our vision is one of universal access to health care in this community. With parity, so access to medical care, mental health, and substance abuse services here in the county. I'm going to end with 2 little stories. I was so glad to hear Catherine talk about the people behind the statistics. I could give you 10,000 stories because every person that comes to our program has a story to tell. I just picked these 2 because they highlight 2 different things about our program. The first is just the story of an asthmatic who had was a user of the ER, showed up at the ER for respiratory distress 3 or 4 times a month. But with the help of the WHP, the member got connected to his primary care medical care home, received disease management education about how to self-manage his asthma, and now he's gone as long as 6 months without using the ER for asthma attacks. That's a nice little success story. Another member in our program, we work very closely with the Michigan Prisoner Reentry Initiative, providing access to care for recently released former prisoners. This was the case of a gentleman who was released from prison to his family home. He had substance abuse issues that got him kicked out of there and unable to go to the homeless shelter. The end of his story is that he's now enrolled in the WHP. He's not using illicit drugs. He's on medication for his high blood pressure. He has a job. He'll soon have housing. Not to say that his enrollment in our program led to all of that. In fact, enrollment in this program was just one small piece of how this gentleman is getting his life back on track. But it is to say that there are many people in this community working in a whole variety of ways to provide care to the neediest folks in our community. And when you think about, is there a will, is there a way, I believe in this community we're doing our small part to move the issue forward. So thanks.